this is nice. I like this wedge because...
So am I pressing up?
No. You're just going to relax a little bit. So I'm just going to deviate onto that right side. I'll show you an exercise for that. Very easy to... You've probably done it before and didn't really realize you were doing it.
Like down into my low back, like across the top of my butt.
Like going down your low back onto the left side?
Yeah, like right side.
So that's probably about like L4, L5, or L3
I don't know.
area.
Ooh, that tickles.
That's L4, yeah. So we're sorry. I had to kind of check myself because the top of the hips actually indicate around the L4 level.
Okay.
So I'm a little bit higher than that. So I'm probably around L3.
It just tickled.
A little bit of sacrum. So if I do this. Let me show that.
Yeah, it's going down into.
And that's your spot.
Yeah. Oh, I mean now it's like, cause you're pressing.
You got your knee.
No, it's like it's not as much.
Intense. So
That's going
sciatic
through my
nerve.
calf.
So if I take this out.
Yeah, now it's in this calf.
So sciatic nerve, two nerves. It's actually kind of like the thickness of your middle finger. It's a pretty big nerve, but it's two combined into one. So sometimes that communication of that nerve can be tethered up here, or it can be tethered from the down up. And you're like in that in-betweener.
Mm-hmm.
So since we already addressed the back, we'll come at it from the bottom up. So these are just nice little nerve stretches. Because there's a difference. Like you can feel a difference between a muscle stretch and a nerve stretch, right? Like you know how to stretch your muscles.
Yeah, I would say I don't know how to stretch my nerves.
Right. But this sensation that you're feeling, that's nerve stretch.
Okay.
It's different. Like it feels like it almost like an ache, a deep ache or almost or something. At times you might get a little bit like tingling when you're like, oh, you're really stretching that nerve. Okay, now let's just test this, see if it what do you feel there?
It's starting in my hip again.
If I add this, what
Yeah, then it goes like all through my hamstring.
to your spot?
Yeah.
Okay. And if I take that away,
Yeah, it's gone.
is it still in the hip?
Mm-hmm.
Okay. And just do a little bit here. So the same thing, stretching out that nerve, because it runs from the low back literally all the way to the big toe. So like behind the knee, the nerve breaks into two. Behind the ankle, the nerve breaks into two different nerve branches. Basically where you bend and flex, that's where the nerves break off and split off. Do you still feel that?
Mm-hmm.
Is the intensity the same? Is it changing?
I'd say it's getting better in my hip, but it's still pretty intense in the spot that's been bothering me.
In the
In my
hamstring?
hamstring, yeah. Ooh.
Hamstring, hip, or one versus the other?
Both.
Here, who complains of right hip pain, hamstring pain. It's been going on for like 3 months. Came to therapy probably about like 3 weeks ago. 2 or 3 weeks ago, I think.
Yeah.
So we've been addressing a little bit more of the back because that's where the nerves originate in the low back. So right now, we did address some of the back issue and I just did some normal mobilizations to the back, and then we retested Alex's range of motion. So we just did some nerve flossing to the sciatic nerve in different planes that really stresses her pain into that right hip. So now we're going to reassess that to see if that cleared up a little bit of that distal right hamstring pain that she's been experiencing. So go ahead into your forward flexion. What's that do?
That's so much better.
Yeah.
Look.
She hasn't been able to touch the floor in how long, Alex?
3 months.
3 months, and she's been doing yoga. I mean, your yoga, she does
I
CrossFit.
cannot believe that.
That's the best it's felt in.
Right. So a lot of times these nerves just get irritated along their pathways, and sometimes you need to cause a little bit of pain to get over that hump of pain. So we're going to check your extension. Let me know what happens. And that looks good.
Yeah, it's still good. I mean, there's still a little bit of the pinch in the low back,
Okay.
but it's better than when I first came in here this morning.
All right, and then we're going to check her Shakira's. is what I thought. It's pretty close. I mean, you're going to have a deficit,
Yeah.
but cool.
But I can't believe
All
how
right.
much better that is.
Nerve, right? Some nerve irritation along that sciatic nerve where all we gotta do is kind of like stretch it, kiss into it, and then we still have to take care of the top by simply doing those press ups with the breathe out at the top.